Good day and welcome to the Global Politics Lecture Series in conjunction with the Global Policy Journal. My name is Melissa Bryan and I'm joined by my friend and colleague Izota Crisafulli. We're both students at Durham University. And today we're pleased to have Professor Ted Schrecker, who is a professor in global health policy here at Durham. Professor Schrecker, thank you for being here.
Oh, thanks for having me.
And first, could you please tell us about the role of economic and political ideologies in shaping global health agendas?
Well, it's an interesting question. When I started working on global health issues more than a decade ago, you would have encountered polite skepticism if you argued that economic integration or the global marketplace had a lot to do with health. Now, the Lancet's Commission on Global Governance for Health has published its report. It came out in February 2014, and it's very explicit about the way in which globalization has contributed to health inequalities and to threats to health in a variety of country contexts. The role of ideology, well, over the past few decades, we've seen the rise of neoliberalism or market fundamentalism, which essentially holds that you're entitled to as much health or as much anything else as you can pay for, and only that. And that has fairly obvious implications for the future of health in societies where economic inequality is growing, sometimes growing quite rapidly. There's another dimension to the question about ideology as well, which involves the focus on biomedical and behavioral interventions, approaches to protecting public health, versus an approach that emphasizes what have been called the upstream influences like poverty, economic inequality, and the drivers of those. And there's an interesting contrast there, because a few weeks before the Lancet Commission on Global Governance for Health report came out, and that's a report that is very much focused on the upstream influences, there was another Lancet Commission report led by two World Bank protagonists looking at long-term goals for global health, which essentially dismissed the upstream approach, the upstream influences, in one paragraph, saying those are all too big, too complicated, too political. So in a sense, there's a struggle going on for the soul of global health that is very much, I think, an ideological struggle, not in terms of the conventional left-right divisions, although those come into play, but rather in terms of whether to focus on the biomedical and the behavioral interventions that are familiar, or the upstream influences that are, to be fair, more intractable politically.
Right, and how can global health agendas be reconfigured to take into account global inequalities of power?
That's a very big question indeed, and I think the Lancet Commission I mentioned on global governance for health has done remarkable work in terms of bringing those questions into the health policy mainstream and identifying some challenges for mechanisms of global governance, the kind of issues that the Global Policy Institute here at Durham is focusing on. Just a few examples. I think it is very important to develop mechanisms that ensure provisions of trade agreements, the findings of the trade dispute resolution panels don't compromise health. The human rights framework is a very powerful tool for doing that, as the Lancet Commission pointed out. I think it's important to develop what you might call health rights impact assessment instruments that can be applied in situations like the current austerity programs here in Britain and elsewhere in Europe, which I would classify as a global health issue in the sense that they're shaped by, in the first instance, by a financial crisis that was global in scale, but also by the global diffusion of market fundamentalism, the idea that you can't really challenge the power of these large transnational financial actors. You can't address these problems by redistributing resources domestically in a progressive way.
Okay, what are the implications of the changing global economy for the distribution of social determinants of health within national borders?
Well, what we're seeing in many countries, rich and poor alike, is a rise in economic inequality, sometimes quite a dramatic rise, and the spread of various forms of economic insecurity. Just to give two examples from countries that are very different in terms of their level of GDP. In the United Kingdom, we saw a dramatic increase in income inequality from the Thatcher era through to the early to mid 1990s. That has now plateaued, but on the best available evidence, we're seeing a continued growth in inequality of wealth, with wealth concentrated near the top of the economic spectrum, and conversely, the spread of economic insecurity, 0 hours contracts, benefit reductions, payday lenders, and so on and so forth. Now, that's not in any sense a consequence of globalization in the sense that those choices could have been made quite differently, and some high-income countries are making them differently. I mean, countries can choose to tame the inequality machine, as Serge Halimi calls it, or they can choose to accelerate it, and the United Kingdom seems to have chosen to accelerate it. The other interesting example is India. Jean Drèze and Amartya Sen in their new book point out that there are countries with comparable GDP that have done far better than India in providing the basic determinants of health, the basic requisites for healthy living. But in India, which has, on the best estimate I've seen, more than 150,000 high net worth individuals, you have 50% of the population that does not yet have access even to basic sanitation. There again, globalization has a lot to do with the way in which the market distributes income and wealth, but it has less to do with the way in which societies choose to challenge or not to challenge the verdict of the marketplace. In the high-income countries, you have poverty rates that vary threefold. That's not because the market acts differently in those countries, it's because of different approaches to taxes and transfers.
Professor Shreka, just to follow up, how limited would you say the policy space for these countries is to address these determinants of social distribution, and what also influences their policy making?
Very important question. The short answer is it depends. That's not terribly satisfactory, so let me try a longer one. There's no question that in some countries, particularly low and middle income countries, policy space is seriously compromised by the way in which financial markets operate, by, in some cases, conditions attached to loans from the multilateral agencies, by what have been called the implicit conditionalities created by financial markets. In many countries have to function with one eye over their one glance over their shoulder at the verdict of the markets, and the markets can destabilize economies in fairly short order, as we've seen repeatedly. But that said, there is still fairly substantial policy space available. countries can distribute the resources they have available to them very, very differently. In the high-income countries, I think the policy space is in fact fairly expansive. Joran Therborn, in the introduction to a recent book on inequalities, says that national rulers have no global alibi for the way in which they choose to distribute resources. I think that's too strong for the reasons I've mentioned, but I think it's also the case that societies and the governments they elect have quite a bit more space than we might think. So, for example, here, it's entirely plausible to think about an economic and social policy regime that would still maintain the productivity of the economy, but it would tax high earners at a higher rate. It would tax expensive houses, which would have the salutary side effect of cooling the housing boom. It would increase benefits rather than reducing them, and it would pay for these things by giving up some of the excesses that are neither necessary nor appropriate, like buying a new atomic missile system for submarines.
I want to ask, what practical mechanisms can be established to monitor compliance to a right to health?
That is, of course, the basic question for putting health rights of any kind into practice. Some countries have, in fact, written the right to health into their constitutions with mixed results. Others have put into place social policies that in effect guarantee the right to health without having it constitutionalized. My suspicion is that measures that rely on judicial enforcement are likely to be least effective where they're most needed, because the most vulnerable people are likely to lack access to the courts. I would like to see some form of health rights impact assessment put into place for national policies and for the operation of a variety of supranational processes, the operation of multilateral lending institutions, and so on. But that having been said, I'm not yet certain what exactly a mechanism like that would look like.
Okay, just one final question. How do you think the existing intellectual property regime can be best modified to ensure that the global poor are guaranteed access to essential medicines?
In any one of several ways. Thomas Poga and colleagues have developed a proposal for a health impact fund that would incentivize, it's a word I hate, but it's the one they use, the pharmaceutical industry to develop new products based not on their market price, or what the market will bear, but rather on how they contribute to reducing the global burden of disease. Right? In other words, it would be the health impact, not the marketability, that would generate the greatest rewards. That would mean, products like Viagra, which is massively lucrative but doesn't have much of an impact on the global burden of disease, would continue to be marketed, but so too would products that it's not very lucrative, not very attractive to pursue right now, such as new generations of antibiotics. Another more radical proposal would be simply to scrap the existing regime as it applies to medicines, not as it applies to computer programs or Xbox software or whatever, and essentially go back to the notion of scientific knowledge as a public good. The problem there is that you don't create the kind of market incentives to produce that the intellectual property system as it now exists provides. But we have to keep in mind the history. Intellectual property protections that are enforceable in any kind of international consistent way are a very recent innovation. Most of the countries that industrialized first did so by systematically ignoring intellectual property protection, especially the intellectual property of people outside their borders. And it's not entirely clear that the pace of technological progress was any slower.
Professor Ted Schrecker, thank you once again for your time.
Thank you.